Herida Healthcare have designed and manufactured the Wilshire II dynamic cushion system for the prevention and treatment of pressure ulcers for patients in all categories of risk. It provides comfort and support by maintaining a good level of blood flow around the body whilst seated. Our Wilshire II contains a unique horizontal cell design that alternates in a 1-in-2 cycle pattern. This type of cushion is ideal for patients who spend a proportion of their day using a chair and can be used in conjunction with a dynamic mattress system under the required supervision to give 24-hour care. The Wilshire II can be used for patients up to a weight of 24 stone or 150 kilograms. The cushion dimensions are 46 cm by 46 cm by 10 cm. The Wilshire II is constructed of a layer of 5 cells. The product operates in a 1-in-2 11.5-minute cycle. The 5 cells will alternate during the cycle. The first set will deflate for 5 minutes, providing relief. They will then start to inflate for 1.5 minutes before the second set of alternate cells start to deflate for 5 minutes, offering relief, completing the cycle. Upon installation, the engineer will either turn the system on, leaving it to inflate by connecting it to the power switch. Normally, the engineer will use a rapid inflator, bringing the cells up to full capacity in seconds. The pump is constructed of a simple design in order to allow ease of use. If we take a look at the panel, there are 2 switches, the on-off switch and the static switch. Once the plug is turned on at the mains and by the power switch on the panel, the pump is then inflated and ready to use. You can then use the weight pressure dial to adjust the pressure accordingly. If you switch on the static mode, both cells will equally inflate, allowing clinical procedures or any other procedure to occur. Once the static mode has been switched on, it is important to remember to switch it off again to restart the alternating cycle, which will then resume the pressure relieving activity. Once the pump has reverted to alternating mode, it will take a short time for the alternating to restart, as one set of the cells will deflate to restart the 11.5-minute cycle. The Herida Wilshire II comes with a troubleshooting guide on the front panel of the pump, indicating what to do in the event of any problems, whether that be a power cut, an alarm function or inappropriate cell operation. If the system has a power cut or power is removed from the system, an alarm will sound to indicate that there is a problem. If the pump has a kettle lead, it could simply be that the cable has become detached. It could also be that the plug has come out of the socket. In all cases, the first check should be that the power is connected and is also switched on. If the system detects low pressure, the low pressure red light will come on. If during the course of all troubleshooting effects you still can't identify the problem, it is important to ensure the tubing on the cell is not kinked. The tubing is located on the side of the cushion where it delivers air to the cells. The tubes will be secured to the cushion by small cable ties to ensure that they do not detach. Regular cleaning of the cushion is required, and we provide cleaning instructions in the user manuals. Copies can also be supplied on request. Maintenance and repair work should only be carried out by an appointed engineer who has been trained by Herida Healthcare. Only original manufacturer parts should be used in any repairs, as failure could affect the warranty. In all instances, with any pressure relieving products, always ensure that you seek clinical guidance and use the product in accordance with manufacturer instructions. Thanks for watching. For further information, please feel free to contact ourselves directly.